Hi, and welcome to 23. This is an exciting chapter. Either students love this chapter or they really don't like it. So let's just go here and let's get started with pregnancy, childbirth, and the puerperium. Okay, with this chapter, our codes are going to begin with O, not zero, O. Okay, so again, when we look at this chapter, we have different rules. We are not coding the baby's chart. We are coding just the mother. So let's keep that in mind. And again, just as I stated, these codes refer to the mother only, used only on the mother's record, and they are never assigned on the newborn's record. We'll get into that, and I can't, again, enough express how if you're coding a mother's chart, it's O. Where baby's charts, again, they begin with P. So with this, let's start going here. We're going to talk about the whole obstetric experience from conception until 6 weeks, okay, after delivery. Keep in mind that a delivery year, they can be up to 42 weeks. Okay, so 3 stages. Let's just go get over, this part out of the way. The first state is the onset of contractions, complete dilation of cervical OS. Second stage is complete dilation and expulsion of the infant. And then the third stage would be the placenta, the membranes come out, and then the uterus is done contracting. So then our puerperium starts at the end of the third stage of labor, and then we have our 6 weeks, okay, which again we hear a lot is postpartum. The biggest thing here that I always tell students that we need to look at is the trimester. So with the trimester, we have time frames. So the first trimester is less than 14 weeks, 0 days. Second one is 14 weeks, 0 days to less than 28 weeks, 0 days. And then our third trimester is 28 weeks until delivery. So here's what we have to do. So if they come in and they deliver in the second trimester, we got to make sure that we use those characters to distinguish that. We also need for doctor's office, the same characters, what trimester is that patient in. Okay, so here's a couple of things. Term pregnancy. We have a term pregnancy is somebody who goes to gestation of 37 weeks, but it's less than 42 weeks. Okay, that's term. Post-term, okay, that means basically the mother's went over, is 40 completed weeks through any number of days a week in 42. Prolonged pregnancy, let's hope nobody has that anymore, 43 weeks or more. Okay, so again, we use the date of admission to determine the weeks of gestation for inpatient admissions involving more than 1 week. Okay, so again, unspecified trimester, we try not to use, especially if you're coding and you have the medical record in front of you. This should never happen. These codes come from Z38 weeks of gestation. So in your code book, okay, what I want everybody to do, let's get this situated here. So I want you to look up okay, so I have gestation, and it does say pregnancy. So a couple of different things that it's going to route us to. Okay, with pregnancy, okay, I am going to look at weeks. Okay, so my terms are, if you need to pause, you go to pregnancy, and then you go to weeks. So whenever you are doing coding, you need to look to see how far a mother is. And then again, pregnancy weeks is how we find this. Something you need to make note of. And this will tell me how many weeks, again, is the patient along. Okay, so when do we not use Z3A? These are for pregnancies with abortive outcomes. Okay, and we'll cover that coming up in the next chapter. We also, and again, the reason we don't is because even when I talk abortive, I mean miscarriage. Okay, elective termination, we call that abortion. For postpartum conflict or conditions. Okay, outcome of delivery. A code from Z37 is assigned as an additional code whenever the patient delivers in the hospital. The fourth characters indicate, again, the outcome of delivery: single, multiple, live-born, or stillborn, multiple births. Do not assign a code from Z37 when the delivery occurs outside the hospital. Okay, so again, it's only assigned that first admission. So let's go back to the code book. All right, so what we are looking for, again, outcome of delivery. And right there we have it. Okay, so, a lot of them anymore, we have a lot of multiple births. Okay, we have lots of twins. So let's just look at this. Again, you cannot use these as principal diagnosis, FYI. Okay, these Z codes need to come, especially the Z38 also. You won't use that as a principal diagnosis. You won't use the Z37 as principal diagnosis. So we have twins, and let's say they're both live born. Okay, so that is going to be Z37.2, twins both live born. Let's say we had twins, both were stillborn, or one was live born, one was stillborn. Okay, so again, there's different ways. We have just a single live born birth, and that is going to be right here, Z39 or Z37.0. Okay, so a couple of things here. What we've learned so far is we will have an O code first, and we'll get into that when you're coding these out. The second thing that you need to know is that you will have the weeks, especially for delivery, how many weeks the mother, and then also you need a Z37 code for the outcome. So again, make notes of that, what you all need for coding. Okay, the fetal seventh character. A lot of times we have a seventh character to identify the fetus for which the complication code applies. So we have seventh characters 1 through 9, which apply in cases of multiple gestations to identify the fetus for which code applies. So again, keep in mind anymore, if I have twins, the doctor knows fetus 1, fetus 2. If there's an issue with fetus 1, that way you can put the diagnosis down for fetus 1 and make note of that. Okay, so a lot of times these are going to be, let's just look here, 030. So go to your tabular right now. Type in O and make sure it's O, not type in, look for. Okay, so here we have multiple gestation. I have twin pregnancy. Let's just go with that. And here it tells us first trimester, which is nice, explains it out. Second trimester, unspecified trimester. Okay, so with that, we will get into also so we know what fetus. Okay, second trimester, again, we have all of those there. With this, we need, some providers refer to each fetus by alphabetical characters. Okay, fetal A equals fetus 1, fetus B equals fetus 2, and so on. So we'll get into that next. Let's just here talk about principal diagnosis. So I said the Z37 for how many weeks can never be principal diagnosis. The outcome of delivery can never be principal diagnosis. But if you're coming in just for supervision, that can be principal diagnosis, Z34. Okay, usually when you have a diagnosis here, complications is usually a lot of times, sometimes you have no complications at all. Okay, then we're going to use 080. Okay, that is, and we'll talk about what can be encounter for full-term uncomplicated delivery. One thing here, use additional, indicate the outcome of delivery, Z37. Okay, how do I come to this if I can do 080? Okay, what all involves here? Well, one thing, it's a normal delivery, single liveborn. Okay, even if I have twins, I have the first one came out fine, second one 5 minutes later, no issues. Great delivery, everything went great. Normal delivery. You still can't use 080 just because twins is not normal. Okay, so there can be no postpartum complications, and any antepartum complication has to be resolved before delivery to use 080. When also their codes from other chapters again will tell you that you cannot use, when you cannot use 080. In your book, make sure there is a little bit more definitions on that. So make sure you do go ahead and review those. And this is no postpartum. So again, it says admission with normal delivery. So review those on your own. Selection of principal diagnosis for cesarean delivery. Again, why did they have to have that cesarean? That's your principal diagnosis. Okay. I always tell students, okay, my water broke, ruptured membranes. Okay, that's going to be the principal diagnosis. That's what I'm coming in for. All right. So again, 080 is not going to be, as I stated, for normal delivery. Okay, so multiple gestation. So if I am having twins, we're going to use an O code, 030001 through there, triplet, quadruplet, other. Okay, so again, there's possibly complications. We have codes for intrauterine surgery, pre-existing conditions. We're going to code those. If they, again, have not went away before they delivered. Hypertension. Keep in mind, we're in the O codes for hypertension. Hypertension and pregnancy. Diabetes complicating pregnancy. These are going to be the 024. Okay. And then if the patient does have diabetes, you're going to use the appropriate E code for the diabetes. Now, gestational is different. This is just while you are in your, usually occurs second and third trimesters. And you're just going to use the O code probably for the once. Doesn't mean you're not going to use the E code, because gestational, again, usually just happens while you're pregnant. And if you had it before, you will add a Z code. Okay, we have HIV and pregnancy. You can review that. Alcohol and tobacco, drug use, complications. Okay, so reading through that. Obstructive labor is a lot of times what we're going to use with for pregnancy. Okay, so with pregnancy, I have 064, obstructed due position of the fetus. I have 065, obstructive caused by abnormality in the mother's pelvis. And then other reasons. Fetal distress. One thing I always tell students, if there's fetal distress, that means the baby's having distress too. So if you're coding that, make sure it's an O code, because again, there's a fetal distress for a baby. You don't want a P code on the mother's chart. Same thing, you don't want a O code on a baby's chart. And then postpartum complications. Okay, sometimes there's a surgical wound infection, sepsis. We have codes for that. Again, cardiovascular. So make sure you read through these. I am going to talk a little bit here on procedures. And I'm going to stop this video because I want to be able to pull up and have you just go through a few in the next video for coding, for some coding help.